In this video, we're going to talk about opioid pharmacodynamics. Opioid pharmacodynamics. And essentially what pharmacodynamics means is the effect that a drug has at the different organ systems. So in our scenario of our opioids, we're going to talk about the effects that opioids have at 5 different organ systems that we will discuss. The first one is the heart. So opioids usually have minimal direct effects on the heart. However, there is this dose-dependent bradycardia. Dose-dependent decrease in your heart rate that can occur. The more opioids you give, the increased effect at decreasing the heart rate that opioids have. And this is likely due to some parasympathetic or vagal effects. So the other effects that opioids have on the heart is at increased doses. If you give high dose opioids, you could see a decrease in your blood pressure, and that's more pronounced if you combine these opioids with these other drugs or anesthetic agents. Now, if we look up here, this dose-dependent decrease in your heart rate, although you don't want it too low, this is where the beneficial effects occur that opioids have on the heart, because opioids can decrease your oxygen consumption on the heart and decrease that myocardial demand. So opioids are good for blunting that increase in myocardial oxygen demand. Now we're going to talk about opioid effects at the lungs here. So I'm going to draw my trachea. There are my lungs. So opioids bind to receptors in the brainstem to cause a decrease in your respiratory rate. It's going to decrease your respiratory rate. Essentially, if you give enough, you will become apneic and not able to breathe. Not only does it decrease your respiratory rate, but it also blunts your ventilatory response to carbon dioxide. So what does that really mean? So let's say we have a patient's partial pressure of carbon dioxide at this point right here with the star. And at this point right over here, the brain senses the PaCO2 level, and it spits out an output telling the patient to breathe if this PaCO2 gets too high. Well, opioids will increase what is called the apneic threshold, where the PaCO2 at which the body tells the patient to initiate a big breath or ventilate is shifted at a higher PaCO2. So at this point, the brain will tell the body to breathe. So a patient could get pretty hypercarbic due to the effects that opioids have at blunting the response, the ventilatory response at a certain PaCO2. And that is known as increasing the apneic threshold and shifting the ventilatory carbon dioxide response curve to the right and shifts down. That's a little bit more complicated, but I just wanted to complete the picture. The other effects that opioids have on the respiratory system is at increased doses, highly increased doses, you can get this chest wall rigidity. So you can get this chest wall rigidity and these muscle contractions, essentially making ventilating very, very difficult. Now we're going to talk about the effects of opioids on the brain. So that's our other organ system that we'll discuss here. So that's the brain. And let's draw the brain stem here. Very loose drawing. So opioids will decrease your cerebral blood flow. They'll decrease your oxygen consumption. And they'll also decrease your intracranial pressure. However, these effects are pretty minimal compared to the other anesthetic agents that we use. At the same time, one of the side effects of opioids is that it works at this area here called the chemoreceptive trigger zone. And this is the area where that gets triggered and stimulates a patient becoming nauseous and vomit. So opioids contribute to nausea and vomiting. That's one of their side effects. One of the other things to note here is that opioids cause unconsciousness, but not amnesia. So you can't necessarily use it as a sole anesthetic agent. And then opioids also cause certain opioids can be used in the treatment of post-op shivering. And the major drug that we use for that is called meperidine. All right, and now we're going to talk about our GI system. So I'll just draw this esophagus, stomach, and then intestines. Opioids' effects on the GI system. There are opioid receptors in the gut. What they're going to do is they're going to slow or decrease gastric motility, causing constipation. They also cause constriction at the sphincter of Oddi, causing biliary colic. And then finally, opioid effects on the endocrine glands. So I'm going to draw the kidneys here, and then we have our adrenal gland here. So opioids have an endocrine effect too. What they basically do is they inhibit hormone release during surgery, the stress hormone release during surgery. And those stress hormones include cortisol, they include growth hormone, etc. So they inhibit stress hormones during surgery. All right, so we'll wrap it up one more time here. Opioid pharmacodynamics, their effects on the heart cause a dose-dependent decrease in the heart rate due to vagal effects. They also beneficially decrease oxygen consumption, which is favorable in patients who have an increased myocardial oxygen demand. At high doses, opioids decrease your blood pressure, causing vasodilation. Respiratory effects, opioids decrease your respiratory rate. They shift your carbon dioxide ventilatory response curve, so you are less responsive at initiating breathing at a certain PCO2. That threshold is shifted further to a higher PaCO2. At increased doses, you could get chest wall rigidity. They decrease cerebral blood flow, oxygen consumption, and intracranial pressure in the brain, but one of the side effects is that they cause nausea and vomiting. And you treat post-op shivering with meperidine. Opioids decrease gastric motility, causing constipation, and they also cause biliary colic due to contractions and spasming at the sphincter of Oddi. And then opioids also inhibit the stress hormones during surgery.